So now we're gonna move on into palpating other structures, including bony landmarks, bony prominences, different sorts of vasculature, and important areas anatomically that you need to be aware of. For this, as a reminder, before doing any sort of palpations, make sure that you obtain the individual's consent. Make sure that you are not using your fingernails to palpate, but rather using the pads of your fingers, and then making sure that you're using enough pressure to feel the item that you're trying to locate. However, not putting so much pressure on that it's causing them an immense amount of pain for this assignment, and then just for general knowledge and practice. For this next group of videos, I'm going to be palpating on myself. However, for the assignment, you'll have to use another individual. This is just so that you're able to kind of see the structures that I'm locating on myself. I also want you to make sure that you know which items that you can palpate over clothing and which ones we should have a clear view of skin for. So make sure you refer to your items to know for this assignment. For the brachial artery, that's an important artery, as you already know, to identify and to obtain somebody's blood pressure. What you're gonna do to locate that, you'll want to find the tendon of your biceps, walk medially over, place your hand with enough pressure to feel the pulsation of the brachial artery. And I can feel it underneath my fingertips now, and I know that I'm on the correct structure. For the cubital fossa, you'll locate that on the anterior forearm. Within the cubital fossa, you have different boundaries and borders, as well as items that run through that. So when you're palpating it, be sure to identify those, as well as verbalize what content it is that you are feeling, and then how you know that you are on the correct cubital fossa space. I'm going to show you both of the medial and the lateral epicondyle together, because I think that anatomically, while you may think that they are equally aligned on either side of the arm, they look a little bit different in the body when you're palpating. So I think it's easiest to find the medial epicondyle first. I know that it is on the humerus bone, right where the elbow attaches. You can see this structure here on me. That is my medial epicondyle. Anatomically, I would be in this position. So my medial epicondyle there. My lateral epicondyle is right here. I'm not on my olecranon, but however, I'm on the medial and the lateral epicondyle of my humerus. For my olecranon process of my elbow, olecranon process of the ulna, it is the structure that forms what most people think of when they think of the elbow point. I can locate my medial and lateral epicondyles, and right in the center of it is my olecranon process of my ulna. There's different structures that attach to it, items that run next to it that you can verbalize for us in your videos to make sure that you are on that correct location, no matter how the arm is moving, making sure you're on that olecranon process. For the styloid process of the ulna, that's going to be distal to the majority of the shaft of the ulna. And for most individuals, that prominence actually protrudes quite a bit. You can see on myself here, if I get the right angle, you can kind of see that is my ulnar process, or ulnar styloid. In order to palpate it, you would locate that structure, make sure that you're on the bony prominence of it, and be able to identify what's happening around it. This is an important landmark for splinting because it is so near the surface of the skin. it's important that we as occupational therapists are aware of what's happening if we're ever putting a device on somebody, so that there's no skin breakdown to the bone. And then it's also a point in which there can be common fractures. For the styloid process of the radius, in anatomical position, you would find your radius bone, work your way down towards the end, and in order to palpate it, that structure juts out here prior to your carpal bones. You can see it on myself right here. As I flex, it stays in position. It's not a carpal bone. And you can see here I've got this structure. That is my radial styloid. For the head of the radius, what you need to do is you can have the person in anatomical position first if that helps your learning and your ability to locate it. But then you know that the radial head attaches and kind of forms a joint at the lateral epicondyle. So first find your lateral epicondyle. You can find your medial too. Make sure that you're not on your olecranon. And then inch yourself down just a little bit. And if you're in the correct space, you'll feel another bony structure that feels like it divots and comes together with your lateral epicondyle. Remember that your radial head is one that's a point for pivoting, for pronation and supination of the forearm. So if I keep my finger on that radial head, I can actually feel the bone that I'm on give a little bit of rotation as I'm doing this movement. To palpate the carpal tunnel, you'll want to find the carpal bones in which the flexor retinaculum attaches to. So that's the scaphoid and the trapezium, as well as the pisiform, and then sometimes like the hook of hamate too. The flexor retinaculum crosses over those structures right at the crease of the wrist. And then you also have some important structures that go through the carpal tunnel, and you can actually feel each of those. So as you're feeling within that carpal tunnel space, be sure to verbalize and identify what is running through the carpal tunnel as you palpate it on your clients. For the radial pulse, you're going to locate that by going to the distal portion of your radius. You can find the radial styloid, come medially to that prior to some of your tendons here. You can put your fingers on that location and you should be able to feel the pulsating underneath. This is a really great structure to be able to identify somebody's pulse and heart rate. I do this frequently, especially if I use electronic monitors and those aren't working. It's a really good way in order to get somebody's heart rate, or if your site doesn't use electronic monitors, it gives you an idea about cardiac function, specifically with exercise pre and post, and then helps you keep the overall health and safety of your clients in mind. To locate your anatomical snuff box, it would help if you also were able to locate the boundaries and borders of your anatomical snuff box. You can actually see mine right here. The boundaries and borders of it, what I'm doing with these tendons is I'm performing the action at the thumb that pulls them the tightest so that they come out and pop out at me. I've got one boundary here that is superior to it, two that are more lateral, and the two that are lateral run side by side. So as you palpate the structure, the actual structure is the space between, but it is good to be able to identify each of the boundaries and borders as well. Sometimes the two inferior border tendons can come side by side and be difficult to find. but if you're able to run your finger over top, you can sometimes feel the difference between those two tendons. So I'll show you on mine. I've got one tendon here, one here, and then one here. And as you can almost kind of see it on the video, I've got kind of those two inferior borders that form the anatomical snuff box. For the bones of the hand, I'm going to show you those all together. Generally, I find that it's easier to palpate those on the dorsal side of the hand because, as you know, the volar side of the hand, we've got so much musculature going on that you can't really feel down to the bones. However, the anatomy of the hand is much different on the dorsal side. And so for your metacarpal bones, you would start at the base of each of those metacarpals and work your way up in order to palpate bone. I am providing a little bit of pressure on the other side just so that I have counter pressure and I know exactly where I'm palpating. But one thing to keep in mind too for each of these structures is that we do have quite a few tendons running through, right, for your extensor digitorum. So you want to make sure that you are on bone and not actually on the tendon as you're doing your palpations. Next, you've got your proximal phalanges. So you know that these start at the more distal end of your metacarpal bones. They go to your IP joint. So in digits 2 through 4, that would be your PIP joint. For digit 1, it would be just your IP. Then you've got your inner phalanges here, the intermediate ones. And so you would locate those from point to point, palpate each of those, making sure to identify and clearly speak to what you're feeling and what you are going to and from. And then for your 5 distal phalanges, those would start obviously the most distal, as in the name, from the DIP to the end of each of the fingertips of all digits 1 through 5.